Hours, others sat for days and weeks hoping a hospital bed would finally open up for their mentally ill child.
The waits are being caused by a shortage of beds statewide, but with demand for services high as they've ever been, why are some hospitals choosing not to add more beds and staff?
Here's 7 investigator Ross Jones.
The thought of putting your 6-year-old baby in a hospital like that is so hard. But I knew I had to do it.
The help Nicole Williams wanted for her son wasn't there when she needed it most. 8-year-old Xander suffers from intermittent explosive disorder and autism, and on a day in April, he attacked his mom and said he wanted her to die. Nicole rushed Xander to the nearest hospital to help stabilize him, but quickly learned doctors couldn't help. There was no room, she was told. Try again tomorrow.
So it's like you get sent home and you're like, feel so helpless and so alone. You know, like, who do you call at 2 o'clock in the morning when you've been restraining your child for 6 hours already?
It took 3 weeks for Xander to finally find a bed, and as our investigation has revealed, he's far from the only child waiting. In July, we told you the story of Kelly Miltimore and her son Liam, who waited 5 weeks for a bed after a violent outbreak triggered by his bipolar disorder and autism. Not long after, we heard from dozens of other parents telling the same story. We spoke with 6 of them here at our studios.
Every hospital was denying him.
We usually heard, we just don't have room.
You take them to the hospital and hope that they can help, and they couldn't.
It's not just parents who are frustrated. The doctors turning families away are fed up too.
I think we're working extra hard in a system that's broken.
Dr. Bernard Bierman is the medical director at U of M's Child and Adolescent Psych Unit. During the school year, he says there's almost always a waiting list just to get a bed in his hospital and in others across the state. But despite the demand, most hospitals, including his, resist expanding the number of beds that can treat children with a mental illness.
There's only so many psychiatric patients we can treat safely in this type of setting. We're constrained by numbers, by the amount of space we have. The amount of resources you have to devote to psychiatric facilities is pretty incredible.
But perhaps the biggest problem is one of dollars and cents. Bierman says caring for mentally ill children often loses hospitals money because many insurance companies won't approve payment for costly treatments. The hospitals often take the loss instead of passing it on to families. So even though U of M is approved to treat up to 32 children, they have no plans to expand from 14. A fact that doesn't sit well with state officials.
Certainly they have the capacity to provide more services. Why are they choosing not to?
Nick Lyon is the director of Michigan's Department of Health and Human Services.
They have an obligation, I believe, to serve people who come in their door.
But the state is contributing to the shortage too by not fully funding its own hospital for children. Built to hold up to 118, Northville's Hawthorne Center is funded to treat only 55. And on the day we spoke with Director Lyon, only 40 beds were being used, while a waiting list grew longer. During the school year, we're told, it can run to more than 50 names long. Lyon says adding more hospital beds would help in the short term, but the longer-term answer is improving the state's outpatient system.
We need to be more effectively utilizing our resources to prevent the hospitalizations when necessary, but then helping people with placements when necessary as well.
How is the outpatient system going to help when my bipolar son is trying to kill me?
It's a good question, and I think that you know, we have helplines that are in place, and that's why I said, you know, sometimes the 911 call may be appropriate.
Today, the state is moving towards some progress, adding 12 to 24 beds designed for children who need long-term mental health treatment, housed here at Hawthorne. It's still in the planning stages, but is expected to open in about a year. Parents say it's too small of a fix for too big of a problem.
The 12 to 24 beds in a year, we need the help now. You feel like there's no hope and there's no help because when you do take them somewhere where you think you're supposed to get help, you don't.
No one tracks just how many children are turned away each year, but hospitals tell us demand for their beds is always highest during the school year. That means those waiting lists will start growing at hospitals all across the state, starting now. I'm Ross Jones, 7 Action News.